Greg Stafford.
Thank you very much, Madam Deputy Speaker. And I know, Madam Deputy Speaker, you don't need any convincing of this, but were you to, the amendments that the Lords have put forward today demonstrate why we need a House of Lords, because they are the ones standing up and delivering the amendments that this government are trying to wriggle out of this afternoon. Amendments 1B and 5B, which the government is trying to derogate from, are absolutely essential for our care services. The financial strain that the government's national insurance contributions are going to put on the social and care sectors is astronomical. Some predictions are around £2.4 billion on social care alone. And that will ultimately lead to reductions in services and, of course, unfortunately, closures, especially around the hospice sector. And the Minister has repeated what he has repeated on many, many occasions, and other government ministers have mentioned, that they are giving a certain amount of money to the hospice sector. But as colleagues on this side have already stated, that is capital spending, and what they vitally need, what they desperately need, is revenue spending to cover the cost that the national insurance contributions are doing. I'm happy to give away.
Gentleman, is he concerned that one of the key elements of fiscal policy that the government patently don't understand is whole system cost? Because when these care providers, whether they're hospices, in-home care providers or social care providers, when they fall over as a result of these measures, as they will, those costs will get picked up by the rest of the system and it will have a net cost to the Treasury.
The honourable gentleman makes an absolutely excellent point, and one that has been made on numerous occasions on this side of the House. I have to say to the honourable gentleman, it doesn't surprise me that the Labour benches don't understand the economy. What I did hope they understand is the care sector, and the care sector has been telling them time and again that this national insurance increase will hit the sector disproportionately and cause them to reduce and indeed close services. I think of Phyllis Tuckwell Hospice in my constituency in the centre of Farnham, which is fortunately going through a multi-million-pound rebuild as we speak. But when it opens, or reopens, it is going to be hit by these national insurance contributions and will have to make decisions about what services it can provide to my constituency and the surrounding areas of Surrey and north parts of Hampshire. And likewise, Madam Deputy Speaker, on Friday I'm going to go and see Shooting Star Children's Hospice, a fabulous children's hospice that I've visited on a number of occasions. And what is galling to me is I see photographs of Labour members turning up to Shooting Star and similar hospices, putting their arms around them and saying what a wonderful job they're doing, and that later today will walk through the division lobby to take money away from them. What hypocrisy, Madam Deputy Speaker. And we already know that there are workforce challenges in the care sector, especially in the hospice sector. So why on earth is the government targeting these sectors to be able to raise the national insurance contributions from? And of course, as honourable members on this side have mentioned, this isn't an abstract cost. It isn't a cost that is going to hit some sort of nebulous business. This is cost that is going to hit patients and indeed in the hospice sector, those who are dying because care will be taken from them. It is a tax on community care. It is a tax on dying, and the Labour government should be ashamed that it is bringing this through. Yes, of course.
I'm most grateful. We've concentrated a very great deal on the children's hospices particularly, and rightly. And I still hope and believe that at the 11th hour maybe the government will have some compassion as a socialist government and give some ground. But the other area that we haven't really touched on enough is the independent care providers who are providing services in people's homes, because they are not able now to employ the people that they need, if they can get them. That means inevitably that those cared for will end up in hospital at still greater cost to the health service.
Well, absolutely. My right honourable friend makes an excellent point, one that was echoed earlier from the SNP benches, and it is absolutely correct. There will inevitably be a net cost to the Exchequer because of this policy, and he's absolutely right that home care is something that we haven't touched on but will be affected. I have home care companies in my constituency that will not be able to expand their staff, which they vitally need in order to meet the needs of people in my constituency. Again, we haven't really touched on it a lot, but pharmacies as well are in this same position. I visited Badger's Wood Pharmacy in Headley in my constituency a few weeks back, and they were saying that this is going to hit them absolutely really, really hard, and it's going to have a real problem on the amount of service that they can deliver for my constituents. Madam Deputy Speaker, not only is it going to have a massive effect on the businesses themselves, on the GPs, on the pharmacies, on the hospice sector, on the home care sector, not only will it have a massive impact on the economy because there will be a net cost, not only will it have a massive impact on patients because they will not receive the services within the wider NHS family that they deserve, but also it runs entirely contrary to the government's stated policy that it wants to bring healthcare close to home, close to the community. So whilst it's exempting acute care, hospital care, away from community, the bit it says that it actually wants to expand, it's taxing. It's totally illogical, even on the government's own policy. So, Madam Deputy Speaker, I hope that the government does have a 11th hour change of heart, either today or the emergency budget tomorrow, because it is vital that we support these sectors. And Madam Deputy Speaker, Lord's Amendment 21B, I think, is the proof of the pudding which is in the eating, as it were. If this government was so convinced that its policy on this was the right, just, fair and proper one, it would allow a review to go ahead so we could see the impact. The fact that they will be walking through the division lobbies later to hide this policy from the British people tells you all you need to know. They know this policy doesn't stand up to scrutiny, and they're running from it.